doctor. I am relieved to see you.
Good day, Lord Montague. I hope everything is all right.
No, doctor. Everything is not all right. It is quite the opposite of all right. You must come at once to see Milady. She is in distress and cries for help.
Please, tell me of her predicament.
She is in her 58th year and suffering from pains of the belly for 3 days' time. She is nauseated and has vomited 5 times during the last 24 hours. Oddly though, she produced stool that was normal in appearance just 2 days ago.
Good sir, please, do go on.
She is afflicted with diabetes mellitus as well as hypertension. 10 years ago a barber removed her uterus and freed her of her hysteria. It was a most gruesome process.
And is she freed from her hysteria?
She was until 3 days ago.
Tell me, what medicines does she take?
She consumes metformin, lisinopril, and baby aspirin each day.
Thank you for this information. I will make haste and examine your ill-stricken wife. After examining your wife, I have discovered that her blood pressure is 140/70 millimeters of mercury. Her temperature is 99.4 degrees Fahrenheit. The rate of her heart is 112 beats per minute, which is fast. Examination of her belly proved to be most informative. You see, it is mildly distended and quite tympanitic, and she has mild epigastric tenderness. Her bowel sounds are increased and high-pitched. Also, I failed to see occult blood in her stool.
Did you perform any other tests?
I did. Studies performed on a sampling of her blood revealed a count of leukocytes to be 18,000. All other parameters fell within normal reference ranges.
Oh, doctor, please tell me you acquired images of her abdomen.
Indeed, I did. Plain films show clearly that there are dilated loops of bowel with air fluid levels. There is also air in the rectum.
What is the meaning of all the data that you have acquired?
Lord Montague, I am compelled to consider the following possibilities as the source of your wife's infirmities. Acute gastroenteritis comes to mind from the nausea and vomiting that has transpired. Also tenderness of the belly and a high white blood cell count support this hypothesis. But what confounds this notion is the lack of fever and diarrhea plus the presence of high-pitched bowel sounds on physical exam. And a subtle but most telling feature is this. All of the other options that I am considering pertain to pathology of the bowel, making a gastric disease process less likely.
Your methods are most intriguing.
Moving on. Ileus could present in this manner, but there would be no bowel sounds altogether. Also, your wife has had no inciting event for this condition, such as recent surgery. And medication-induced ileus, say, from narcotics, is not likely because you did not tell me that your lady consumes these medicines, and I trust that you are not lying to me. Next. Comorbidities like atherosclerosis predisposed to embolic events that cause mesenteric ischemia. There was no blood in her stool and, once again, you did not make mention of your wife suffering from atherosclerosis. Furthermore, I have ruled out mesenteric ischemia as a possibility.
Ah, pure genius.
Now, sir, is where it becomes interesting. Your wife's problem is caused by volvulus of the sigmoid colon or partial small bowel obstruction. The presentation of both can be very similar and sometimes misleading. I believe the answer to this mystery resides in the abdominal images. You see, volvulus is a complete obstruction, making the presence of air in the rectum unlikely. I clearly saw air in the rectum on the acquired images. It is this final clue that makes partial small bowel obstruction the most likely diagnosis.
Doctor, how can you be so sure?
Having taken the USMLE step examinations myself, I can apply the precept which states, when you have eliminated the improbable, whatever remains is likely the correct choice.
You are most wise.
Patient satisfaction, baby.